Now it's time to talk about your health. If you need help and relief from the sight and pain of varicose veins and other vascular issues, well, let me tell you something. We have help today from Dr. Dawn Olsen and also Western Vascular Institute. Dr. Olsen, thank you so much for coming in today. We appreciate it.
Sure, thanks for having me.
Okay, you are a vascular surgeon. What exactly is that?
Sure. A vascular surgeon is a specialist who diagnoses and treats all the problems in arteries and veins. So the only territories that we don't manage are the brain, the vessels in the brain, and the vessels on the heart. But our vascular training is dedicated to identifying vascular disease and then managing it, whether it be through medicines or lifestyle modification or surgical interventions.
All right, let's talk about specific conditions that vascular surgeons treat.
Sure. So we treat from head to toe. We can identify blockages in the arteries that feed the brain, for instance, the carotid artery, and then blockages in the upper extremity, in the gut, in the legs, and all of those are managed either through removing the plaque, a stent that you see on the screen there, or through open bypass.
Okay, now what about venous disease? What exactly is that? I feel like we've heard of that. What exactly does it mean?
Sure, we address venous insufficiency as well, and you can see some of the diagrams on the screen right now. There are these little flaps within the vein, and those flaps help to prevent backflow in the vein. Usually the blood flow is directed from the legs upward to the heart. When those valves become injured, then we end up with swelling and pain and varicose veins in the lower extremity.
Yeah, and how do you know that you have this, it's venous disease?
Right.
How do you know if you have it, and how do you know if you need treatment for it?
Sure. So patients present with a multitude of problems. They mostly come in with swelling in the legs, pain and heaviness in the legs, fatigue, especially beginning and worsening throughout the day. And then some have the larger varicose veins that you see on the screen. They'll also get discoloration in the lower extremity and sometimes ulcerate.
Yeah, it can be very, very painful and dangerous too. What about treatment options? What are some treatment options for people?
Okay, so the mainstay of treatment is compression. So we would start the patient in compression hose that they apply daily. We would do a duplex, an ultrasound, to identify the degree of insufficiency. In the past, we used to strip the veins. We don't typically do that now. Things are minimally invasive. So what we do is we're able to look at the vein under ultrasound.
That we're seeing here.
That you see there, and then we place a catheter inside of that vein, and we purposely destroy the vein, basically from the inside, so it collapses. So it's done through a small nick in the skin, and then that should begin to give the patient relief.
Yeah, and here we're seeing the compression wear that you can wear. Because doing these things can really make a huge difference for people.
Definitely. It definitely helps with their lifestyle. They don't have the pain, and then to prevent those ulcerations that can eventually come to.
All right. Tell us about Western Vascular Institute.
Okay, sure. Western Vascular Institute has been in existence for almost 15 years, I'd say since 2005. It is comprised of 6 surgeons, myself being the only female in the group. There are 3 locations that we have, one in Payson, one in Mesa, and then we have an office down here in Phoenix at 3rd Avenue and Osborne.
Yeah, and if people want to learn more, do you say come in and have a consultation?
Oh, definitely. Yeah, we're always available. Patients can usually get an appointment within a day or so if they need an urgent evaluation, and we do our own studies in the office. So we can see any concerns that the tech might identify at that time.
All right, excellent. Well, thank you so much for coming and explaining this to us and giving people the help that they need. And for more information, everyone, to make an appointment, just go to westernvascular.com or call the number on your screen.